Regulator of health products in South Africa says the so-called rapid test kits being offered for the diagnosis of COVID-19 are not suitable for their purpose. It's appealing to the public to report anyone selling the kits. We speak now to Andrea Yulsing from the South African Health Products Regulatory Authority. This is quite concerning. Andrea, as things stand in South Africa, are these legally sold? Is it even an option, or do you go straight to your healthcare professional?
I think what's important to remember is that there are actually two types of what we might call rapid test kits. We've got the molecular test kits, which are also known as PCR, and they can also sometimes be referred to as a rapid test kit because technology has advanced, and so now we're seeing tests that might have taken a day to perform can actually run in 45 minutes. So those could also be called rapid test kits, and that is what is currently being used in country and around the world to diagnose for the COVID virus. I think what you're talking about now is the serological test kits they're finger prick tests where you collect a blood sample. Now, I think what's also, again, important to understand is that the serological test kits will have a place for use. They're important when we look at research and then also surveillance within our population, but they are not recommended for case detection. So the World Health Organization, as well as the National Institute for Communicable Diseases, has at this stage said these tests are not recommended for diagnosis of the virus. So that's really the key message that we're trying to drive home. So as a lay person, you shouldn't be seeing websites advertising, call it self-test kits that would then be used in home. These serological tests, the finger prick tests, are actually intended for use under the supervision of a healthcare professional. So what we want to do from the regulator's point of view, anybody who is manufacturing, importing or wholesaling medical devices needs to have a SAHPRA license, and we already have issued license for importers of the PCR molecular test kits, and we know that those are going straight into our labs for use. But what we also need to recognize is that there is going to be a place for the serological test kits, and we're gearing up now. We've had a number of applications coming in, and we are trying to facilitate licensing so that the serological test kits can come in and then be directed into validation protocols with the labs. Because any kind of serological test, which is actually testing antibodies, it needs to be validated for proficiency in our population. So again, I just want to touch on this element of testing for antibodies and where it differs. Where you do a molecular test, that is the traditional thing that we've been seeing now, where patients are being swabbed and the swabs go to the labs for processing. That is actually to detect the genetic material of the virus. This finger prick test, or the serological test, will actually detect whether there are antibodies to the virus in your system. So as we know, it takes time for antibodies to develop, and that is why the serological tests are not intended for diagnosis of acute infections.
Thank you very much for that clarity. So a time will come for self-test kits, but that time is not right now. Andrea, before we let you go, please do allow me to be opportunistic here. So looking at world trends in terms of what is happening specifically in Italy, where people are running out of ventilators, in the United States, where they're turning places where they produce cars to be centers where they can produce ventilators. Where South Africa is concerned, do you by any chance know, do we have enough ventilators? Are we producing our own even?
Majority of our ventilators are imported, but there have been really some innovative initiatives coming through, driven by Department of Health, DTI, and then local players who have said they're able to repurpose their current manufacturing structures to support the production of ventilators in country. So we're working closely with these groups to be able to up the supply and work with the teams to make sure that what is developed in country and manufactured here is meeting the requirements for safety, quality and performance.
Thank you very much for your time. Andrea Yulsing from the South African Health Products Regulatory Authority.